Many men notice gradual changes in energy, recovery, and daily stamina as they get older, but lifestyle habits often continue to play an important role. Simple routines related to sleep, movement, nutrition, and stress management may support overall wellness over time. I'm Dr. Hina Kim, and continuing to learn about healthy aging can help men better understand how the body changes through different stages of life. Dr. Hina Kim, Men's Health and Wellness Specialist. The truth about aging and energy. As men move through their 50s and early 60s, one of the most common concerns I hear about is energy. Many men notice that they do not feel as physically strong, mentally sharp, or consistently active as they did years earlier. In most cases, this is not about one single cause. Aging affects the body gradually, and energy levels are influenced by many daily habits over time. One important factor is sleep quality. Even when men believe they are sleeping enough hours, the body may not always reach deep, restorative sleep. Poor sleep can affect focus, mood, physical stamina, and recovery from normal daily activities. Another area that often changes with age is muscle health. After age 50, the body naturally begins to lose muscle mass more easily. This can make everyday tasks feel more tiring than before. Regular movement, light strength training, walking, and staying physically active can support mobility and overall energy. Nutrition also plays a major role. Some men eat less protein as they get older, while others rely heavily on processed foods or irregular meal schedules. The body still needs balanced nutrition, including protein, fiber, healthy fats, vitamins, and proper hydration. Hydration is commonly overlooked. Even mild dehydration can contribute to low energy, headaches, and reduced concentration. Many adults simply do not drink enough water throughout the day, especially when they stay busy. Stress can also affect energy in ways people may not immediately recognize. Long-term stress may impact sleep, appetite, motivation, and mental clarity. In many men, ongoing stress creates physical fatigue that slowly builds over time. Hormonal changes may also become part of the conversation as men age. Natural changes in testosterone and metabolism can influence body composition, recovery, and energy levels. That does not automatically mean something is seriously wrong, but it can be helpful to discuss symptoms with a healthcare professional if changes become noticeable. I also encourage men to pay attention to daily routines rather than searching for quick solutions. Consistent sleep habits, balanced meals, regular movement, social connection, and stress management often support overall wellness more effectively than extreme health trends. Another important point is that energy is not only physical. Mental fatigue, lack of routine, reduced activity, and social isolation can all contribute to feeling drained. Maintaining hobbies, purpose, and regular engagement with family or community may support emotional well-being as well. It is also important to understand that aging itself is not a disease. The body changes over time, but many men continue to maintain active and healthy lifestyles well into later decades by focusing on sustainable habits and regular health awareness. Routine medical checkups can also be valuable. Conditions such as sleep issues, blood sugar changes, blood pressure concerns, nutritional deficiencies, or medication side effects may sometimes contribute to low energy. General health monitoring can help identify areas that deserve attention. In my practice, I often remind men that small daily habits usually matter more than dramatic changes. Simple consistency is often more realistic and easier to maintain over time. And when we continue talking about healthy aging, there are also important discussions around mobility, metabolism, recovery, and maintaining long-term wellness that many men may not fully understand yet. Many men are surprised to learn how strongly daily movement affects long-term energy regulation. The body responds well to consistency. Even moderate physical activity performed regularly may support circulation, joint function, muscle maintenance, and overall endurance. This does not necessarily mean intense exercise. For many adults over 50, simple activities such as walking, stretching, light resistance training, cycling, or swimming may be easier to maintain safely over time. Recovery also becomes more important with age. In younger years, the body may tolerate irregular sleep, poor eating habits, or physical overexertion more easily. As men get older, recovery often takes longer, which is why rest and balance become essential parts of wellness. I also encourage men to pay attention to eating patterns throughout the day. Skipping meals or relying heavily on sugar and highly processed snacks may contribute to energy crashes later. More balanced meals with protein, vegetables, healthy fats, and fiber may help support steadier energy levels. Digestive health can also influence how the body feels. Changes in appetite, digestion, or nutrient absorption sometimes become more noticeable with age. Eating slowly, staying hydrated, and maintaining balanced nutrition may support digestive comfort and overall wellness. Another area that deserves attention is alcohol intake. Some men notice that alcohol affects sleep quality, hydration, recovery, and energy more significantly than it did earlier in life. Moderation can become increasingly important for maintaining daily function and well-being. Caffeine habits are also worth reviewing. While moderate caffeine intake may help alertness for some people, excessive use late in the day may interfere with sleep cycles and recovery overnight. Mental wellness should not be separated from physical wellness. Ongoing stress, constant worry, lack of relaxation, or limited social interaction may gradually affect motivation and perceived energy. Emotional well-being often influences physical wellness more than many people realize. I also remind men that maintaining health does not require perfection. Long-term wellness is usually supported through realistic habits that can be maintained consistently rather than temporary routines that become difficult to continue. Preventive care is another important part of healthy aging. Regular checkups, routine screenings, and open conversations with healthcare professionals may help men stay informed about their overall health status as the body changes over time. In many cases, small adjustments made early may support better quality of life later. That may include improving sleep schedules, increasing daily movement, reducing sedentary time, improving nutrition, or simply paying closer attention to how the body responds to daily habits. It is also normal for priorities to change with age. Many men begin focusing less on intense performance and more on maintaining mobility, independence, energy stability, and long-term function in everyday life. And as we continue discussing healthy aging, there are additional factors related to metabolism, muscle preservation, cardiovascular wellness, and healthy routines that can further influence how men feel physically and mentally over time. Cardiovascular health is one area that becomes increasingly important during the aging process. The heart and blood vessels play a major role in delivering oxygen and nutrients throughout the body, which directly affects stamina, physical performance, and overall daily energy. Regular movement may help support circulation and heart health over time. Even shorter periods of consistent activity during the week may provide benefits when compared with long periods of inactivity. Sedentary habits are becoming more common in many adults. Extended sitting, low physical activity, and reduced mobility may gradually affect posture, flexibility, muscle function, and metabolic health. This is why simple daily movement matters. Standing more often, taking short walks, stretching regularly, and avoiding prolonged inactivity may support joint comfort and circulation throughout the day. Body composition also changes naturally with age. Many men notice increases in abdominal fat along with gradual muscle loss. These changes may influence mobility, endurance, and overall physical comfort. Nutrition becomes especially important during this stage of life. Adequate protein intake may help support muscle maintenance, while fiber-rich foods may support digestion and metabolic health. Whole foods are often a practical foundation for healthy aging. Vegetables, fruits, lean proteins, legumes, nuts, healthy fats, and adequate hydration may support overall wellness more effectively than highly restrictive diets. I also encourage men to pay attention to consistency rather than perfection. Health routines that are simple and sustainable are often easier to maintain over the long term. Sleep routines deserve continued attention as well. Irregular sleep schedules, excessive screen exposure late at night, and inconsistent bedtime habits may affect recovery and daytime alertness. Creating a calmer nighttime routine may support healthier sleep patterns for some individuals. Reducing late-night stimulation, limiting heavy meals close to bedtime, and maintaining a consistent sleep schedule may be helpful lifestyle habits. Joint health is another topic that becomes more relevant with age. Flexibility exercises, light movement, stretching, and maintaining a healthy body weight may support comfort and mobility over time. I also remind men that physical wellness and cognitive wellness are closely connected. Mental stimulation, learning new skills, reading, social engagement, and maintaining regular routines may help support cognitive function as the years progress. Social health can influence physical health more than many people expect. Maintaining meaningful relationships and staying socially connected may positively affect emotional wellness, stress levels, and daily motivation. It is also important to understand that healthy aging looks different for every individual. Some men focus on maintaining strength and activity, while others focus on mobility, independence, or improving everyday quality of life. The goal is not to compare the aging process to younger years. The focus should be on supporting the body realistically, maintaining function, and making adjustments that fit long-term health needs. And as we continue exploring aging and energy, there are also important discussions around metabolism, recovery capacity, inflammation awareness, and maintaining sustainable daily habits that may help men feel more balanced as they grow older. Inflammation is another topic that many men begin hearing about more frequently as they age. It is important to understand that inflammation itself is a normal biological process. However, long-term lifestyle habits may influence how the body manages stress, recovery, and overall physical comfort over time. Daily habits such as poor sleep, inactivity, smoking, excessive alcohol intake, and highly processed diets may place additional strain on the body. On the other hand, balanced nutrition, regular movement, stress management, and adequate rest may help support overall wellness and recovery capacity. Weight management also becomes more complex with age. Metabolism naturally changes over time, and many men notice that maintaining body weight requires more consistency than it did in earlier decades. This is one reason why sustainable habits are often more helpful than extreme dieting approaches. Very restrictive routines may be difficult to maintain and may sometimes contribute to fatigue or inconsistent eating patterns. I often encourage men to focus on long-term patterns instead of short-term expectations. Gradual improvements in sleep, activity levels, nutrition, and stress management may have meaningful effects on overall quality of life over time. Breathing and lung health are also important parts of healthy aging. Regular physical activity may help support endurance and respiratory function, while smoking and chronic inactivity may reduce physical capacity over the years. Posture and balance also deserve attention. Many adults spend long hours sitting, which may contribute to stiffness, reduced flexibility, and muscular discomfort. Gentle stretching and regular movement throughout the day may support mobility and physical comfort. Mobility is closely connected to independence. Maintaining strength, coordination, and flexibility may help support confidence in daily activities as the body ages. Men should also pay attention to recovery after physical activity. Soreness that lasts longer, slower recovery, or persistent fatigue may sometimes indicate that the body needs more balance between activity and rest. This is why recovery days, hydration, nutrition, and sleep are all important parts of a healthy routine rather than signs of weakness. Another important area is emotional stress management. Chronic stress may affect appetite, sleep quality, focus, energy levels, and motivation. Relaxation techniques, outdoor activity, hobbies, social engagement, and regular routines may support emotional wellness. I also remind men that healthy aging is not about trying to stop the aging process. The goal is to support the body in a realistic and sustainable way while maintaining function, comfort, and overall well-being. Consistency often matters more than intensity. Small healthy habits repeated regularly may provide more lasting benefits than occasional extreme efforts. It is also valuable to remain patient with the body. As men age, physical changes may happen gradually, and healthy lifestyle adjustments may also require time before noticeable improvements are felt in energy, mobility, or daily stamina. Preventive awareness remains one of the most practical approaches to long-term wellness. Paying attention to sleep quality, nutrition, physical activity, stress levels, hydration, and routine medical care may help men stay more connected to their overall health needs. And when discussing energy and aging further, there are also important conversations around healthy routines, daily recovery, metabolic balance, and maintaining physical resilience that continue to play a role in how men experience wellness over time. As men grow older, the body naturally changes in many ways, but healthy aging is often supported through consistent daily habits rather than dramatic changes. Paying attention to sleep, movement, nutrition, hydration, stress management, and regular health awareness may help support overall wellness and quality of life over time. It is also important to remember that every individual ages differently. Small, realistic adjustments that fit into everyday life are often easier to maintain and may contribute to better long-term balance and well-being. I'm Dr. Hina Kim, and I encourage men to stay informed, stay active in ways that feel sustainable, and continue having open conversations about health as they move through different stages of aging.